Are you a business owner looking for real advice and input? You're in the right place. From concept to launch to growth, funding, and beyond. Welcome to Startup Hustle with your hosts. One once sold a business for $150 million. The other, the author of $1 Million Bedroom. Here are your hosts of Startup Hustle, Matt DeCoursey and Matt Watson.
1, 2, 3, 4, 3, 2, 1. 'Cause no one can do it like we do it, like we do it.
And we're back. Another episode of Startup Hustle. Matt DeCoursey here with Matt Watson. Hi, Matt.
What's going on, man?
Just here for another episode of Startup Hustle, which is brought to you by Fullscale.io. You heard of those guys before?
Yeah.
Yeah.
I'm just here to drink coffee.
I know. You're doing a great job. Yeah. Oh, wow.
Yeah.
Can't believe I let you do that.
Yeah.
Anyway,
Just here for the coffee today.
and our content. I believe that.
Yeah.
I believe that. So for those of you listening, we'll let Matt just drink coffee and I will just converse with today's guest, who is here to help us in our continued discovery of up and coming health care technology. Her company is one of the Launch KC participants in the health tech vertical. And we've had some prior guests in here on that. So we're going to go ahead and introduce Linda Bernier, the CEO of Spoke Health. Linda, hello.
Hello. Thanks for having me.
Hello, hello, hello.
Well, thanks for coming in. Yeah, we had a big debate as whether it was Bernier, or different stuff. Yeah.
You can, in Vegas, say Bernier.
Bernier, yes.
That's just over the edge.
We did leave that one out.
Yeah.
So, we've had listeners in 190 countries. So someone in France is cringing right now,
Yes,
or
yes.
somewhere in a country that speaks French.
Actually, Quebec is where my roots are. So
Oh,
Oh.
yeah.
you
I
have
always
to say
forget
it-
about
you
French
have
and
to say
French
it right.
Canadian.
Yes, we have a very unique language.
Yeah.
Interesting.
Yeah. Well, if I'm ever up there hunting pelts, isn't that how the French ended up in Canada?
I don't know.
Yeah. Well, I like it when you're interactive. So go ahead and grab your phone, open a browser, do whatever you need to do. Go to spokehealth.com. You can get a basic overview while we talk to Linda about what her company does. So with that, Linda, why don't you tell us what your company does?
Great. Thanks for having me here among the fun people. So Spoke Health is a technology platform built to create a marketplace for low cost, high quality episodes of care, like surgeries. So we have a platform that can be used by TPAs, third-party benefit administrators, payers, and health systems. Ultimately, it's for employers who are self-funded. And what we do is we help their employees navigate a really stressful experience like a surgery. So we say from ouch to outcome. So when somebody has a surgery that they are about to engage in, we identify if they're eligible for a program that we would actually put them in, which we would facilitate the shopping experience for a provider, guide them to a lower quality, higher quality, lower cost provider, and then help them and nudge them pre and post care. And
So Matt needs a knee replacement
Yep.
because he's getting old.
Yep.
And
He's
we're
among the many.
self-insured. We're self-insured. So
Yep.
we would use your product for me to figure out where I can get the cheapest, best and cheapest knee replacement.
Correct. You would so the employer would use our solution to basically help their employees through this very stressful
Which helps
episode.
the company save money.
Absolutely,
as well.
25 to 50% savings. So today,
What do you know?
people-
We create competition and things are cheaper.
Hey,
Well,
Matt, as a
yeah.
shaper of words, I do not like the word cheapest.
Yeah.
It is the most affordable.
Yes.
well,
but that's
yeah.
got to be part of it, right?
Right.
Like you mentioned, you don't want I don't want the shittiest heart surgeon that is
Right.
available. Like
right.
you might want value, you might want most affordable, but I think that's a key ingredient,
Right.
isn't it?
Well, it is, and we have an algorithm in our platform that identifies the quality. Right. So someone who has done a lot of knees, for example,
Mm-hmm.
you want to go to that person. We also index the cost. So we know based on a contract, hopefully a bundled contract with an employer, and also the ability to identify geographic locations. So if somebody is willing to drive a little further, they could get an even lower cost. And then potentially even, get some incentive. So our clients right now are up to a $4,000 incentive to pick providers in their defined network.
So how does this end up impacting the patient who maybe doesn't give a shit because they're not paying the bill?
Hang on, Matt. That's an important question, but
that's the problem with our healthcare.
We didn't get into this. You deal primarily with companies that quote self-insure.
Right.
Correct.
And I think that a lot of people listening probably aren't even aware that this is a thing.
Yeah.
So when companies get to a specific size and they're paying a ton for healthcare, which they do, no matter who you are, it actually on some levels makes sense to not pay these huge premiums and actually come out of pocket for different things. So that's exactly could you talk about that for a second and then answer Matt's question? Because I think, like I said, it was not until a couple years ago I even realized that was a thing.
Yeah. Yeah, it's a trend that's growing. So even groups of 100 and more are going to self-insured. So there are 155 million people in the country covered by employers, right? So half the United States is employer-sponsored coverage, and 100 million of those are self-funded employees with self-funded plans.
100 million people?
100 million.
Wow.
So two-thirds.
Every big employer.
So every big employer over a size of 100 or 500 or whatever are self-insured, and they're joining other self-insureds and collectives, and that's a whole other lesson in employee benefits. But the truth of the matter is that they're not getting value by fully insuring their employees. It's expensive. The average increase per year is about 5% increase in healthcare costs every year.
And people like me, I don't even go to the doctor. I go I go twice a year, if that, and maybe once. And it's because they call and they're like, yeah, we want to do your annual physical and take a blood draw and whatever. And then I don't go, and I probably spend $10,000 in premiums. I've even made that comment. I said, I'd probably be cheaper for me
just to pay out of pocket. Yeah. Which is the trend toward high deductible health plans, which is the lowest cost plan, but with a high deductible, and you just basically paying cash and you're paying for a big event.
Now, what do these companies do? Because you mentioned the term big event. That's the reason you actually keep insurance. It's not about covering your annual trip for a physical. It's about what happens when something major happens.
And prescriptions.
Yeah,
true.
Prescriptions, right? Although a lot of times people can go to the pharmacy and find out that their prescription through their employer is more than GoodRx or one of these coupons. So it's a very interesting game.
Okay.
Right? But we insure ourselves because we think there might be some big event, some trauma, in which case if you don't have insurance, you can't fund it, it's a big deal. Right.
Right.
So getting coverage through your employer is how we structure the healthcare system. It's either Medicare, Medicaid, you're uninsured, or you're covered by an employer. So the self-funded employers are really today driving the disruption in the industry. The payers are not moving fast enough, and so you're seeing these consortiums of big payers or big employers rather, like Marriott and others, who are basically saying we're going to transform the industry our way because we hold the dollars.
Now, didn't I see, there were some big tech CEOs or big CEOs of companies that got together that were kind of on this? Yeah.
So you're seeing Amazon, JP Morgan, right? That's called Haven. Walmart was really one of the pioneers in these programs, and particularly in the surgery savings programs, where they would take employees and say, if you are going to have a surgery, we have a relationship, with these clinics or Cleveland Clinic, and we're going to send you there, and we'll pay for your travel. And they found that ultimately saved the money, and the employees had a great experience.
So you mentioned, Matt, you talk about creating some competition. I think a lot of people also don't think that medicine is very much a business.
Yeah.
And, a lot of surgery places, it's not like you just go down to your local hospital. Some of these things are occurring, and they're private entity, private office kind of things. I mean, these are people that have like a marketing department and different stuff like that. So forcing them to be competitive is probably quite effective. Is that the thesis statement with this?
It is. It's absolutely a marketplace for competition. You're seeing it in the electives, right? Plastic surgery, It could be dental and so
LASIK,
forth.
things like that.
LASIK is a great example where people are paying out of pocket, and when people
they're more likely to price shop.
Absolutely, when it's coming out of your own paycheck and your own pocket, you're going to shop.
That was the thing you talked about with why do they care?
Yeah.
Because honestly, I don't care if it's not my money.
You don't.
I just want it to be convenient.
But that's the problem is, in some sense, we all should care because it ultimately makes our premiums higher too.
Right.
Yeah. I mean, and we should also all care about our carbon footprint and do different stuff like that. I mean, and I'm just saying because it's not always because it's not directly in front of you in turnkey. Anything, it's human nature to take the path of least resistance, every time.
My kid broke their arm. I'm taking him to the hospital. I don't give a shit.
Well, in that situation, I think that's more like an emergency.
Yeah. Right. Yeah. So we're talking right now, although there are opportunities in that regard, with telemedicine and other, technologies. However, in elective surgeries, I have a friend who had hip replacement. And she has good healthcare coverage. And she said, it costs $100,000. But don't you think her employer, it didn't matter to her. She just went to whoever she was referred to, but she could have gotten a hip for $50,000. And her employer could have sent her somewhere.
Or she could have flown somewhere else in the world and got it for $1,000.
She could have flown, right. And you also,
that's the other problem with this. It's crazy.
Right. Well, you have to think about quality. So our platform actually has its roots in medical tourism. So we can talk a little bit about that.
Yeah, I was going to bring that up because your co-founder was in here meeting with us and talked about that. And, you guys have some roots in the Philippines as well as we do. And, it blew my mind when we went to get healthcare for our employees in the Philippines. And I was looking, they had it's funny, they sent over this brochure that was kind of like a menu of what to expect cost to be. I was like, I can get a heart surgery for $6,000.
Absolutely. Well, that's how we started the medical tourism company. Yeah. So our founder, Jason, was in the Thailand, actually, with his wife. They were about to have a baby. They went to a hospital and they evaluated, okay, it's cash pay. They told them what the price was going to be. Did they want an upgraded 2-bedroom suite, the meal plan, etc. Right? So think of it as a bundled package, right? And they said, okay, $3,000. He walked out the door. 2 other hospitals approached him and said, here's our package and our price. Now, can you imagine how, just efficient that is? That's a marketplace, and had a fabulous experience to the point where he went back and had his second baby in Thailand. So you take that concept of a marketplace with efficiency and price transparency and quality, and you try to mash that into our U.S. healthcare system, it's a challenge.
Well, right now, insurance companies, it's their motive for everything to be as expensive as possible because they get a percentage of it. So they don't give a shit either.
Well, and they're taking a piece. Right? And so
they get a percentage. So they want it to be more expensive.
Yeah. Well, where it's actually, the whole thing is about misaligned incentives. Mm-hmm. Employees are not incented to find quality, lower cost care because it doesn't hit them in the pocketbook yet. If it does, they're on it. And then they're not tools that help them. The payers are, lack innovation. They're slower to innovate in these areas, and they try to make up, frankly, margin from the government programs, which is squeezed, right? Mm-hmm. Medicare and Medicaid. And then you have the providers who are very happy with the fee-for-service environment because that is how they've done things, and that's how they're able to cover their costs and expenses. And so when you see high costs, a lot of it is because the health systems are just they don't know the prices, right? You go and have a surgery, they can't tell you the surgeon costs X, the facility costs Y, right? The anesthesiologist and so forth. And our platform is sort of the, I call it the Tesla packager of a healthcare episode, right? So you can go online and buy a $50,000 car and all the components and you have options. And then there's a discount for bundling, right? And you get a great quality vehicle. In our healthcare system, you can get a price. Sometimes it's called a bundled contract. And usually it's we're going to do your hip for $25,000, but we'll go figure out how do we break that up later, right? We'll bundle and unbundle that price. The real way to do it is to know cost accounting. right? Go in and know your prices and to be able to do a direct cash pay. So what if you could pay for a surgery between, let's say, an employer, which is what our platform does, between an employer and a health system, and say, we know we're going to just, when the surgery's done, the anesthesiologist gets $1,000. The surgeon gets their couple thousand, facility, and we can actually just direct pay once somebody leaves.
So general marketplaces are, about as fundamental to capitalism as they get. They have existed since commerce existed. Now, with that, any marketplace that is vibrant is known.
Yeah.
Meaning, the Romans knew where their marketplace was for seafood or for whatever, and that continued. So I would think one of the challenges that you guys have is getting people to try to potentially look at doing something different than the way they've done it. Is that a challenge that you're having to overcome?
Yeah, absolutely, and it's a nascent market right now. A lot of pilots, but our big challenge is really trying to get folks to think on a broader scale about this market. And there are innovators out there and the early adopters, and those are the ones that we're working with. So we're working with a large health system right now. They actually get it. They have a strategy that says we're going to direct contract with employers. We see this Walmart thing going on, this Haven thing, right? We see what Boeing's doing, and they're thinking about the land and the world after fee for service. What is it?
Well, and they actually want to get paid.
They want to get paid,
and they can cut the insurance middleman out.
Well, so there you go, right? And I spent most of my career in payer land, so it's an interesting thing to be on the side of the table that says, well, I can help payers. We can help you do this. You've got to get out of your own way and scale these kind of, value-based programs. Otherwise, you're going to get fired.
Yeah.
Right?
So one of the things in this, and I'm sure you guys had to figure this out too. So I've always, anybody that wants to start a marketplace, regardless of what it is, it could be classified ads. And that was my example. Years ago, I got tired of getting kicked off of classified advertising sites for promoting my other websites. So I was like, you know what? I'm going to build my own. And I built a couple really cool classified sites. And all of a sudden I learned a really hard lesson. And that's that people don't stay long in empty marketplaces.
Yeah.
So anytime no matter what you're doing, you have to figure out a way to populate said marketplace.
Right.
How did you guys go about going from because the empty marketplace is real. I compare it to that, to midnight on a Friday night. If people walk into a bar and it's empty, they just turn right back around and leave.
Right.
I know that because I used to be a doorman at a bar and I watched it happen in places. But but the same thing occurs on websites. If we keep mentioning a knee surgery.
Yep.
You go on knee surgery providers and there's one provider in there.
Yeah. Yeah.
So how do you overcome that?
Yeah. That's the same thing in medical tourism, right? You have to have a many-to-many approach where there's a volume there that there's choice. So, frankly, the way we're starting is we're really targeting the markets where there are these programs already started. But the longer term vision is to create a network of these surgery centers of excellence, if you will, and offer them up on our platform.
And so do you guys only do surgeries?
Right now, look, it's 36% of an employer's spend is surgery. It's a big chunk of their spend. $700 billion industry, $200 billion of waste in that industry. And it's just, it's a place where you can have the biggest cost savings impact. Yeah.
So, and I think it's also that's something that is a little more planned than people think.
Yeah.
Right.
Is that right?
Because
if you couldn't do it for emergencies, because no one, like you mentioned, your kid breaking an arm. Let me see what the best marketplace. If I could drive 4 hours away to take,
they're not always elective, but they're planned.
They're planned, correct?
Most are.
Yeah. So if you look at the big spend for employers, these high cost procedures, and particularly for an employer that has employees that are doing maybe some manual work and so forth, where they have repetitive injuries or back pain, which is a huge industry. Frankly, if you want to guide them to therapy, which our platform would do, therapy first, then figure out, can they do this in the outpatient environment? If not inpatient, okay, inpatient, where's the best place for you to go? And it could include travel. So, so the surgery was really a great place to start because we could save 25 to 50% on some of these procedures. There's a 200 to 300% variation in cost in the same geographic location. So you can, in Dallas, get a knee surgery, total knee for $45K, or you could get one for $20K, right? So these costs are just really variable. And so there's no mechanism to shop, frankly, unless you're motivated
So
to.
historically, because companies have been self-insured for quite a long time, that's not necessarily new.
Right.
But how did they do this in the past? They really struggled with this optimization.
Yeah. I mean, they were looking for their partners on the benefits side. So their health insurers or their TPAs, right, to help them.
The same people they would have used if they were insured.
Correct. I mean, and so what you see is this whole industry now of packagers.
Yeah.
And they're saying, we're going to make the claims administration a commodity, and we're going to offer a one-stop shop for all benefits. So primary care, we're going to do chronic care. We're going to help you with specialty, right, with your surgeries. We're going to help you with your telemedicine. We're going to package it in, and you employer, have the easy button. We're going to be one stop shop for all of your health benefit needs. And that's because we failed to package it for the employer who's forced to figure out how to put these pieces together themselves.
You mentioned something earlier about the expedience of, is that a word?
Expedience.
It is now, of paying. Cash, the cash flow is the lifeblood of any business. It doesn't matter if you're a development company or a medical company. Is that something that you guys are attempting to improve too? Like, hey, because I figure you mentioned that for a reason. That's a pain point.
It's huge. Yeah. I think the physicians and facilities are fairly used to a delayed payment from the insurance companies, and they go through. That can be
really significant. Right. You're talking about $50,000 knee surgery. Absolutely. You might do 2 of those a day.
Now, in their defense, I think payers have gotten better at doing, making those payments. However, the way we can facilitate discounts, right? How do you get to that 25 or 50% savings? There's a couple of levers. One is driving volume to a provider. That's interesting, right? So now I'm filling up my empty slots and I've got volume coming in. The second is if you can take away administration, then I'll give you another extra discount.
Sure.
Right. So those together. So our the way we've architected the platform, sort of going back to our medical tourism roots, is we could facilitate in a perfect world, cash pay world, a transaction between a self-insured employer who has their money set aside for their employee health and basically pay directly once the procedure is finished. All of the components, not just one $25K paycheck, but what if we could allocate to all the people involved in the surgery?
So I know what my next business idea is. We are going to do nothing but knee replacements here in Kansas City. We'll do yours first as an experiment.
Yes, and we'll charge you a lot of money.
And we'll only charge, say, $15,000
for my knee.
No, we'll do yours for free.
Thanks.
Yeah, and then we'll go to Walmart and we'll do knee replacements only for Walmart. We'll fly everybody to Kansas City. We'll do all their knee replacements here. I think they have a lot of door greeters, and I think they need knee replacements.
Yeah.
We're going to do all of them right here.
Yep. Well, I mean, that's what they're doing.
And it's going to be super high volume. We're just going to run them through.
Yeah.
So first off,
$15,000 a pop.
I need to let everyone know I am actually not in the market for a knee surgery because I feel like that I'll get like multiple messages after this comes out. I'll get a couple LinkedIn like, hey, I heard you were looking for a knee replacement. Yeah, I'm not. I mean, I am seeking a brain transplant or maybe a full body transplant. When you add the category that will allow me to,
I don't know if you're the right co-founder for me. Then I need a guy who needs a knee replacement.
What does that have to do with the founding team? So Linda, you're from Denver, right?
I live in Denver. I'm originally from Maine.
And your company's from Denver.
Our company's from Denver.
Well, welcome to Kansas City.
Yeah, thank you.
And you're here as let's talk about Launch KC for a second, because this is something we've been so many people are trying to get their business started. You guys are at a stage that's a little more advanced than a concept. Mm-hmm. But what made you apply to launch KC? Like, what was the draw? What was your experience with that? And like, I mean, any words of encouragement for those that seek that stuff? Because I think you had a triple digit number of people that applied, and you were one of, I think, six.
One of
Is
six.
it six? Yeah.
Six total. Yeah. I have to tell you.
And congrats, by the way.
Yeah. It was a tremendous opportunity when you're in this phase of a company, particularly with Spoke Health. We don't have investors who are healthcare experts. So it was our strategy to find a partner and investors who are, really strategic and understand the healthcare industry and are connectors. If you look at Tera Capital, they actually have a portfolio of companies that are part and parcel and very adjacent to what we do. That Value Health, do a little promo for them. Build surgery centers. They have a focused factory approach to surgeries, and so this whole sort of portfolio under Tera was really attractive, and the program itself was unique in the level of investment and attention from Kansas City as well as from other key stakeholders in Kansas City. And I think it's impressive the amount of effort that has gone into this program. And we were really excited. Look, Denver's a huge healthcare tech market. It's a lot more competitive, fragmented. And so the race there for capital is a little different. And we just sort of found a real great place here in Kansas City. And we think there's some long-term opportunity here.
If you want to check out Launch KC, you can go to launchkc.org. It's that simple. And then they're coming out with new verticals. One of the things that I can't, well, first off, and also let's give a shout out to Jeremy over at Tera Capital. So that's and Jeremy, thank you for what you're doing, because it means a lot. I've seen how much this has meant to the companies you guys are supporting and just bringing people here to KC. So I think that's pretty cool. Yep. To give a little background, Tera Capital, they're a fund and they invest in health tech.
Yep.
So I love the way, Launch KC pivoted. In prior years, you would have gotten a grant.
Yep.
Which is useful, but I feel it's nowhere near as useful as the way they pivoted it. And they found these top level partners, in your case, someone that has a vested interest. That's smart money. Yeah. They have other companies, funds, things, people, and they made an investment in your company, not just a grant. So they actually have a vested interest on some level with everyone that they're participating with. And I would think if done well, that leads to, it's an easier path to future investment too.
Absolutely. It allows a little dating before you get married. Yeah. And there's a very big incentive for Tera, and shout out to Jeremy and the team there as well. But they really have studied our business. Yeah. And we were one of the, I think Jeremy will say, they looked at us really, really hard. I think I demoed to them 3 times in a week or 2 weeks because they were just fascinated with what we were doing, and they really understand and took the time to understand and really get where we are in our cycle. And so that had huge value for us.
Right.
Yeah.
Matt, do you like that pivot they made? Like, rather than a grant, like, hey, here's some smart money.
I love it. Yeah.
I mean, Absolutely. It's just such a better, and
they partnered with some great companies to kind of lead, and, hopefully Tera can help you guys with go-to-market strategy and partnerships and stuff like that. And like all the ones that were in Black and Veatch's stuff, like they were doing partnerships with Black and Veatch and like MVPs and proof of concepts and this and that and whatever. And it's like, that's amazing.
And NBKC is the FinTech. Okay. And they got a couple more, and, I can't talk about which ones they're coming out with, but, this is something you want to keep your eye on if you're listening, because this, even though it's called Launch KC, it's not just a Kansas City program. Half of the companies that were in the clean tech vertical are in San Francisco. We visited them. We've already published podcasts about them.
Yeah, these accelerators make so much more sense. Like, Techstars is cool, but it's kind of generic help, right? So this is cool that it's like they're almost like strategic partners,
right?
That can really help move.
And you mentioned that thought out part of it. Like, that's the thing. Like, some of these things, I don't want to say, like, anything you can get into that puts you around in an environment of winning and innovation and helping you move stuff forward is a big win. But the specificity of these things is really strong because they're tailor making things. Like they literally treat your class like it's different. Like we have had meetings and by the way, they went out and they did a lot of work ahead of time trying to find partners like Full Scale. So we're the official development partner of Launch KC, and we gave a $10,000 credit to every cohort that's been approved. And, just think about that. I mean, that's 10 grand you might have spent somewhere. And it takes time and effort and all this stuff to negotiate those deals and get all this stuff set up and do a whole lot of things. And I think the folks at Launch KC will be the first people to tell you right now that they're learning every day, a whole lot, and it'll just keep getting better. And I hope that more things and accelerators pivot towards that, because I think that the grant mentality is great, but I just think it could be improved.
Yeah, especially in our situation, we have really three core people on our team. I'm the token healthcare person, and it's always fascinating to me. You have a couple people in a room who are going to transform healthcare but don't know the industry, right?
Sure.
So to have the mentorship, the focus, we can ask the stupid questions in a safe environment. They understand what we're going through in our stage of maturity. And so it's been a great combination, not only just from Tera and Don Peterson, our entrepreneur in residence, and has been a great coach for us as well, but from each other. And you would think that you put a room full of companies together, one, for tracking cold and flu and a mindfulness solution for opioid addictions, and you put us all in a room, and you would think we're not related. But ultimately, we all have something in common. We have helped each other out tremendously. So that's been great.
And you talk about that thoughtfulness too. None of the companies that any of the groups are like competitors. Like they're complementary of each other. Like we had the folks from Med Zero in here.
Yep.
And and I know you've met them. I'm actually going to lunch with them after we record this. But that was Matt. That's they helped the financing of the deductible stuff.
Right.
And, like that, I mean, you talk about they're solving a very similar, but, you never know what's going to happen. Like come back in 3 years or 2 years and whatever. And that's what I think is so fun about getting people in winning environments. Like we do these sweet and greet events where we bring entrepreneurs, investors, and influencers together into a room, and we're like, hey, have fun.
Yeah.
Go to a concert. We're going to WWE on Friday, right?
Yeah.
Yeah, that's right. Right. But it's
I'm
interesting.
going to body slam you.
Good luck.
Yeah.
You're going to
need a knee.
You're going to need a knee and a back after that. Cause I'm a big kid. If you can body slam me, I'm all for it. I'd like, all right. If you want to see Matt try to body slam Matt, that'd be the good name of an episode. Matt slams Matt.
What is that called where like, I get up in the corner and I jump off and like land on the table and then hit you with a chair. Like I don't remember.
It's called Awesome.
Yeah, that's what we're gonna do on Friday.
It's called Awesome. Yeah,
it's gonna be great.
Yeah. So, there's something redeeming and satisfying about watching a grown man in tights throw another man through a folding table. I don't know what it is. It's like,
it's a Friday night for sure.
Yeah, and it's on national TV for like the very first time in their first contract. So. Yeah, it's funny. We've had a good time doing goofy stuff like that. Like we did a 2-day event at a rodeo in town. So we did the startup Roundup. And like that, we invited early stage startups. We got a couple investors to stop by and just different stuff like that. And, these are the things that's why they use the term incubator or accelerator, because these kind of collisions are important.
Yeah.
Get your business out there and around other people.
So startup body slam.
Yeah.
So there you go.
Boom.
That's a new one.
Boom. Shakalaka.
Yeah. The problem is I don't even need to market that event because enough of us are like, we're lowbrow enough to want to just go automatically.
Well, you've been asking me to go to all these different events. I'm like, whatever, Celine Dion.
It's a
and I'm like,
monster truck.
Yeah, monster trucks are okay, but they're not that great when they're in a small arena.
Yeah,
it's too loud.
It's not that. They need some room to get moving so they can jump really high and crush even bigger things. You got to go to a football stadium for that.
Yeah.
Speaking of things that should be occurring in your local arena or football stadium, it's time to play Mixtape the Game.
Oh, yeah.
Have you played Mixtape before?
I have not.
You're about to.
Okay.
So if you want to check it out, go to mixtapethegame.com. I have pulled a card out of the Mixtape deck. I'm going to read a scenario. We are all going to answer with a song that comes to mind, and then we will vote. You may not vote for yourself. You are 8 years old. You're riding shotgun next to your dad, and he cranks the volume, and this song comes on. I know I'm supposed to name a song, but like my dad but all right, my dad doesn't. Well,
I'm gonna go with Queen. We Are the Champions.
Did Dave used to listen to that?
Oh yeah, he's hardcore classic rock, and I know I'm getting old now when I listen to classic rock.
You're getting old when the music from you being in high school is on classic rock.
When you're in Kansas City and you listen to 101 The Fox, you're officially
So I'm gonna lose with this answer, but my dad just did not listen to music. My mom did, but my dad would like crank up NPR.
Yeah,
I listened to that too.
Hey, I had Lawrence Welk. So my father would make us sit in front of the TV when I wanted to watch, Mutual of Omaha, Animal Kingdom.
I forgot.
Remember that show?
Oh yeah.
And he would.
That was back when we had 3 channels.
Linda. Oh yeah, and then he would change the channel and be like a 1 and a 2 and a 3, and it would be Lawrence Welk. So that was my Sunday nights.
Do you have a specific song?
I think it would be Frank Sinatra, sort of New York. So my dad loved to go to Vegas. So
and listen to New York,
and listen to New York, to anything Frank Sinatra.
Okay.
So.
Now, if this is a mom question, I would have a whole list because it's funny when my wife made me watch Mamma Mia, I knew all the songs because my mom raised me listening to ABBA.
Oh, that's good.
And my wife was like, "Wait, how do you know all the songs?" I'm like, "These were other songs before they were in this movie." And then she was like, "How old are you?" I'm like, "Old. I'm getting old." All right, Well, where's your vote? I know I've thrown myself under the loss bus here, and I have a winning streak going too. But I feel like the integrity of the game is what matters here.
You don't even have an answer.
I'm literally saying NPR. And Dad, why didn't we listen to more music? Like, why, Dad? Why? My dad listens to a lot of these episodes.
NPR is not a song.
It is.
I know,
not
but
song.
we
not a
okay,
song.
All right,
default.
If my
Limp Bizkit is a song.
Wait. It is not actually. It is not. All right. So you know what? If my dad had to pick one song that it would have been the Notre Dame fight song. Yeah. That's There you go.
Well, I got to vote for
Notre
her.
Dame fight song.
I got to vote for her.
I knew I wasn't winning this the moment I read the deck. So I'll vote for Linda too. Congratulations.
Thank you. Do I win something?
Yeah, you win you win your own version of mixtape.
Excellent.
We need to take a picture of that because Joel Johnson brought by all
You
these
also have to
mixtape
throw
decks.
your egg at the stack and knock one
No,
out.
do not
I could do that.
Stop.
I could totally do that.
We mentioned
Please.
We mentioned the egg.
I'll give you 2 of them if you do it.
All right. Oh.
For
right.
no, you're
Challenge.
no, Matt. This isn't the fucking state fair. Jeez. By the way,
His
the thing that
OCD will not allow this to happen.
No, I just don't want to deal with this. And by the way, the thing I haven't told you is I super glued all those together. So it's like
it comes in one
truly
big,
like the state fair.
With the craggle?
You actually can't win.
Okay.
You got the craggle
I
out.
want the teddy bear.
It's a craggle.
Yeah.
You know the Lego movie and the craggle?
No, man.
The crazy... Okay.
No,
Oh.
man. No, I actually just pretend to watch my children's
Okay.
movies. I don't actually pay attention
all
to
right,
them.
fine.
Jill was amazed that I actually did not recognize any of the songs from Frozen. I was like, "Yeah, do you think I was really paying attention and like watching?" No.
You have a chance. It's coming. Round 2 is
I know,
coming.
I know, I get it. Oh, is it really?
Yeah, November.
Mm.
Yep.
Well,
Get ready.
yeah. So you're going to win your own mixtape deck. And by the way, for those of you
Super.
listening, because I think you might be interested, Matt mentioned the egg. And we'll hold these up. So hold your egg up to the camera. If you're watching on YouTube, you can go forward to like the 38th minute and check this out because we actually have these things to keep people from doing this. Yeah, the egg. I'm trying to let people really experience this with us.
Yeah.
So with that, we close out our episodes now with what we call the Founders Freestyle.
Great.
And you get to say whatever you want. So
Great.
Go ahead.
Really appreciate the opportunity. A lot of fun to be here today, and we're hoping you check out Spoke Health. I think we have a great technology solution for healing the healthcare system and disrupting the inefficiencies that you see there. So we want to work with employers who are looking to innovate, and we're willing to help their partners like payers and health systems to get there as well. So
I think this is a great company. Glad you're in town. Came from all the way from Denver to be here. To great to see what Launch KC is doing and bring companies like that. And you guys are solving a real world problem. Cost of healthcare is ridiculous. I am excited to partner with you on my new startup for the knee replacement thing.
Yeah,
that's going to be big.
I have a technology for you for that.
Yeah, that's going to be good. So
I'm still confused about who's doing the surgeries.
Well, we're going to work on that. But yeah,
it's like a drive-through.
Yeah, exactly.
Right?
Yes, wow. Exactly. Yeah,
mixed surgery. That's the way.
We just line them up and knock them down.
You'll probably get like three.
Comes with fries.
If you can get an audience at SoftBank, you can probably get like $500 million worth of funding for your drive-through.
Yeah, we'll do this at WeWork. Yeah.
There you go.
Come in and we chop your leg off and put a new knee on.
That's a good way to use the buildings, man.
Matt, I want to point out that you have once again truly maximized your freestyle.
Yeah.
Yeah.
So no, I think what they're doing is awesome. So
I agree.
Right. Thanks.
It's great.
Before I close this out, once again, brought to you by Fullscale.io. If you get a chance, check out Matt's business at Stackify.com. Helps you monitor the performance of your web stuff.
Because everybody's code sucks.
It does. And it'll even give you a grade. If anything, plug it in so you can see what your, what do you call it? The app score?
Yeah.
Yeah.
You might get an F+.
Is that, do you actually have a plus grade on an F?
No.
Yeah. I feel like that should just be like a poop emoji. Like if it's an F.
That's what we should do.
Just do a poop emoji.
That's the world we live in now. Everything's
your
emojis.
code equals poop emoji. Yeah. So yeah, I wanted to use some of my freestyle to call out Matt's other business, but really in the end, I want to, and I've said this for most of the folks that have been here associated with a local accelerator or something, check this stuff out, people. Everyone that I talk to when I go out and play, they're trying to get something started. They're trying to do something, but then I ask them what they're doing about it. And they just seem to be sitting on their hands. Activity breeds sales is what I say. Like the more prospecting you do, the more, like theoretically, if you buy more tickets, you might have a better chance of winning the prize. I mean, and that's just what it kind of comes down to. There's a reason the NBA draft gives more little ping pong balls to the worst teams. They, the more irons in the fire. How many cliche and different sayings can I put in this? But the main thing is just like get out there and do something.
Make it rain.
Dude, I'll fire the money gun here in a minute. But yeah, but the whole point is that, I mean, how bad you want it? And you don't have to sit down and fill out 400 applications in a day. Take a big task and break it down. You can, if you apply to 4 accelerators a day for a month, you've applied to 120 different things that can move your business forward. And that you could probably do that in 30 minutes a day. So is you getting your stuff moving worth that kind of time? Maybe play less Nintendo or whatever. What do the kids play these days?
Candy Crush.
Whatever.
Minecraft.
Yeah, but put your phone down or use
Fortnite.
it or use it to do something
I'm
useful.
busy doing Fortnite dancing.
Is that a thing? Can you make your dudes dance in there or your players
That's
dance?
like the whole reason you play
Hero.
the game. Yeah,
Guitar Hero.
There's a whole generation of kids now that have learned to dance because of Fortnite. You have so many things to learn.
Dude, I'm actually doing things that are moving me towards my goals. And I know I'm not going to be an esports world champion. So I just don't even try.
Well, if you would do more dancing, you would need that knee replacement faster.
And then I could drive through McWatson's.
Yes. And get your knee replacement.
With some fries.
For $15,000.
Right.
Yeah.
And you get fries.
Yep.
If any of you would like to comment on the viability of Matt's drive-through knee replacement, you can, you know what? I don't do this often. Just email him, watson@fullscale.io. I think that he's really trying to move forward with this and would love your impact or love your input.
Yeah.
Anyway.
And your knee.
See you next time.